Welcome everyone. My name is Jessica Pierce. I work for the National Council of Juvenile and Family Court Judges, and I will be your host today. For many of you, you may recall that we did webinars last year, right about this time, to talk about COVID-19 and sort of what we were anticipating the pandemic would look like for juvenile drug treatment court processes as we move forward. Of course, I don't think any of us could quite predict at that time last year what things would end up looking like. And now that it really does look like we're rounding the corner on the pandemic, we wanted to talk with all of you about changes that have happened in your practice related to the pandemic and some of those changes that you might be bringing forward with you. So today, this is going to be an audience discussion session. And so I'm going to ask for you all to be doing a lot of conversing with us in chat. And then what I'm going to do today is just ask a series of questions to you. We're going to be looking for you to respond to those questions about how your court is handling things and how you think things might change as we move into this post-COVID era. I'm joined today with an esteemed panel of folks who are going to be looking for themes in your chats. And so they're going to be responding to that. I'm going to do a very quick introduction. I'm going to kind of call on everybody and just ask them to say hello and welcome you here with me. So first up of our panelists, I have Judge Anthony Capizzi from Ohio. Judge Capizzi, please say hello.
Sure. Hi, I'm Tony Capizzi. I'm the administrative judge in Montgomery County Juvenile Court. I oversee both a family treatment court, a juvenile mental health court, and of course, a juvenile treatment court. Thank you. Thanks for coming.
Thank you, Judge. And then Martha Blomquist from NCJFCJ.
Hi, everyone. Welcome. I'm a senior site manager with the National Council of Juvenile and Family Court Judges. I'm a colleague of Jessica's, Wendy, Elisha's, and Malika's here at the council. And thank you for taking time to be with us today. I'm looking forward to hearing what your experiences have been a year later and what you're looking at going forward.
Thank you. And next alphabetically is you, Elisha Harris.
Hello, everyone. Thank you for being here. My name is Elisha Harris, and I am one of the site managers with the NCJFCJ. Glad to see you guys here and happy to hear what you've got to say.
Thank you, Elisha. And next is Wendy Schiller.
Hello, everyone. I'm Wendy Schiller. I'm a senior program manager at the National Council. Like my colleagues here, I'm excited to listen to how folks are thinking about their practice and their programs as they went through America's longest year. So let's think about what are some things that are good that we can keep that increase our engagement of youth and families.
Thanks, Wendy. And last but not least, Jackie Van Wormer from the National Association of Drug Court Professionals.
Thank you, Jessica. Good morning or afternoon to all of our attendees. I'm Jackie Van Wormer. I am the director of our Juvenile Technical and Training Assistance Initiative, our portfolio of work at NADCP. Just to give you the heads up, I'm having some technology challenges this morning here. So hopefully I'll be able to hang in there with you today, but I look forward to this conversation.
Wonderful. And this is part one of a two-part. This is a two-part series. So we're going to be talking to hopefully all of you again in a week. So today we are going to focus on how things have worked for you and your court. So, you know, things that are happening within the court program. And then next week, we really want to expand that and talk about what's happening outside of court and how you've encountered maybe challenges, but maybe also had some successes around like school, how treatment has felt during this time. So today we're really thinking about court process, getting kids into the program, seeing them through the program and how that has worked for everybody. So that's the division of our time. And we're talking today for just about an hour. So again, appreciate everybody. Let's get started. First, I want to make sure everybody knows that we are federally funded. We do have money. The National Association of Drug Court Professionals and the National Council of Juvenile and Family Court Judges have partnered on a project to provide training and technical assistance to juvenile drug treatment courts. This funding comes from the Office of Juvenile Justice and Delinquency Prevention. And of course, today, all of our opinions are those of the speakers, and anything that you see in chat is the opinion of the audience member. and do not represent any official position of the federal government. Okay. So let's jump right into our first question. And I wanted to ask this question to really just give you kind of free reign to answer what you think. So what has been the most surprising thing about the changes that your juvenile drug treatment court has made in response to COVID-19? And so I'm going to ask everybody to write their responses in chat. And Judge Capizzi, actually, while everybody's writing in chat, I wondered if you could talk about what has been the most surprising thing for you that you've seen in your court.
Sure, Jessica. First of all, we need to pretty much identify for different people where they are in the process of COVID. In my particular case, I run the largest juvenile treatment court in Ohio. We were shut down in March of 2020, but by June 4th, that first Monday in June, we were back working in the courtroom. I've talked to a number of judges around the country who still aren't in the courtrooms yet. And so it's very different where you are. But let's just say from March until May, we met with a lot of challenges. I would say the most surprising thing is that how we switched from a in-person, we all thought we had to be in person for every youth that appeared before the court.
Right.
We learned over the last year that we could accomplish a lot by way of virtual meetings, be it Zoom or some other type. And so right now, on my docket, my juvenile treatment court docket, which is my drug court, probably 40 or 50% of it is done virtual, and some that still have come in. So the bottom line is every week now, I don't see everybody in person, and I used to do it that way. And what's surprising is that the change has not been a real negative. We have found some real positives in the change, which I assume we'll talk about throughout this actual presentation. But I think in summary, youth are much more accustomed to doing things with technology. I think we're getting much more family input and appearances. It's a lot easier for a family or parent who's working to take a half-hour break and be on a hearing for their child from work, be they be sitting in their car in the parking lot or be in an office they may be in and taking a half day or whole day off of work. And so we're getting a lot more buy-in from families, and I think they're more comfortable with what we're doing. There are still certain kinds of cases. What people need to understand is you can't do everything by virtual system. You have to have some types of hearings in person. And so even with treatment court, you have to really take your time, experiment, and see what works best. But I think we'll never go back to the old way, Jessica. There is a new norm. A new norm is going to be probably 50% of appearances will be by Zoom regularly, even after post-COVID.
All right. I love the idea that, we've been, I think, thinking about technology and how that could transform court processes for a long time. But I think that people were hesitant to kind of jump in there. And so perhaps it is kind of an unintended silver lining here that we have, that everybody's had this opportunity to experiment, partly because they didn't have any other choice.
Of course, Jessica, before you move on, I want to say one thing. There's a caveat there. You need to make sure that when you're giving families an option, that you give them access to the internet situation. Dr. Van Warner is having her challenges. We got to make sure our families and our children have access to the internet, access to appropriate web bandwidth to be able to get it done. And so it's more than just saying, here's a link to a website. You need to work with these children and families to make sure they have equal access. And that's a critical part of making these changes.
And I think I've heard also from other judges that there is a piece of that technology where we've got to think about confidentiality. And so, saying to parents, you can participate in this hearing virtually is great, except for that we need to make sure that everybody else in the room isn't overhearing what's happening. And so I think there definitely are some kinks to work out, but it's interesting to think that going forward, you think about half of the hearings could be in that virtual environment.
Yes.
And Jackie, since we do have you for sure on the screen right now, I'm going to ask you what you're seeing coming into chat.
Well, lots of great feedback, and I appreciate it. Everybody keep putting your information in there. Again, this is kind of a crowdsourcing idea. We in this field of juvenile drug treatment courts, we learn a lot from each other. But I think Beth Smith brought up this issue of really efficiency. Switching to the virtual environment, court and case management, they can do more with less time. When we come into the staffing room, oftentimes as a big team, sometimes we can end up kind of going down lots of different paths of information and sharing, and spend a lot of time in those sessions. So it does create efficiency. And I think you can still be just as effective, but it does create efficiency. I don't know if you've seen that, Judge Capizzi, in your process. Is your staffing a bit more efficient?
It is. People, frankly, defense lawyers don't talk as much in a virtual network. It's better because people talk less and get more to the point of what you need to do. Another point is that in many cases in treatment courts, we have youth that are placed in treatment facilities, sometimes in different parts of the state. And for those youth that used to have to come and appear, it was very difficult to have them do a 2 or 3 hour drive to come to appear for a half hour or an hour hearing. And so for those youth that are actually in treatment, it's a real benefit for them to be able to maintain their treatment levels and not waste as much time, and things are much more efficient.
All right, and Martha, I'm going to ask you if anything stood out to you in the chat today.
Well, along the lines of what Judge Capizzi just said, people have mentioned that the virtual meetings have actually helped reduce that barrier of transportation. So he was talking about youth in a facility coming to court, but even just youth in the community being able to take advantage of telehealth. So being able to maybe have a better engagement in treatment when they have the telehealth connection, although some people are noting that with a rural area, the technology connection can be challenging. But you know, that help with reducing the transportation barrier and increasing engagement in treatment sounds like a very important plus.
I think so too. And I'm really hopeful, I think, for the future, where it feels like we're getting better and better broadband across the country. And I know many of you as courts actually provided your youth and your families with like hotspots so that they could participate. Or I know some places you guys even bought like prepaid phones for folks to make sure that you could do this remote work. And so I think one of the things that surprised me the most was how, and I don't know why I'm surprised, because I know I've worked with tons of drug treatment courts. And so I know that all of you are really focused on making sure you're meeting the needs of the kids and families. And so you were so creative and so flexible in making sure that this environment would be effective. Wendy, I'm going to call on you last here to make any final comments on anything you saw in chat that we haven't yet talked about.
I think Martha and Jackie covered it really well, just thinking about those surprising benefits, right? And then thinking about maybe the surprising challenges that you had to work through. And I think juvenile drug treatment court team members were really adept at figuring out what that meant, to the point of even holding really robust graduations online. I observed, this isn't from chat, but I observed graduation on Zoom, and the team actually gave out awards for youth who decorated their backgrounds the best. They had a contest. And so just the way they went to extra mile to make sure that the youth and families were still feeling uplifted, and that what they were doing was important, still important.
Jessica, I think, Wendy, not to pick on that place, because I don't know what you're talking about, but remember in the beginning, I mentioned certain things should be done in the courtroom. All my graduations are still in the courtroom. It's Zoomed for everybody else to watch, but I think it's so important that we have the child come in, the family come in, have the balloons, have the cake, because we want to honor that youth. And I don't think you can do that as good on Zoom as you can in person. So that's one of the few things that I demand be done in person.
Yeah. And again, that just goes to what you first said, Judge, depending on where you are, yes, right, whether or not that would be allowed, right?
Right.
Yeah, I think there are definitely events, and I know we heard about this with high school graduations, that don't feel like they actually happened if you're not there. It doesn't feel tangible. So I understand how that makes sense to folks. All right, so I want to move on to talking about referrals, because we know that referrals have been, well, a challenge, right, during the pandemic. And so in addition to my question, I actually have a couple of polls I want to ask about referrals. How have you handled referrals during the pandemic? And I know that for some courts, you've maybe stopped for a minute, but then restarted your referral process. It could be for some courts that you decided just to pause altogether and haven't taken any new kids in a year. And then for some courts that you've taken referrals throughout. So I just want to get a broad sense of where folks are, and then we will.
And Jessica, can I break that into two parts? I mean, you've asked the question, but I
Yeah.
would wonder if people in the chat would distinguish referrals from assessments. Because I think in some communities, the referrals kept coming, but the challenge of COVID was not getting the referral, was how do you assess the child once they're referred?
So there was actually, so you'd still get kids getting in trouble and maybe coming in, and the
Right.
judge would refer, or probation would say, hey, this kid's been on probation and now we need to have them do something else or something more. But that getting the assessment piece was harder.
It was different. Let's just say it was different. You know,
Okay.
so I do think the referrals in most places, and I think you can tell from looking at the answers, everybody kept on taking referrals throughout the process. But it's that second part of it, because referral isn't enough. And someone needs to decide if that child qualifies to be in the program. So how's the assessment part of it work? And was that a challenge? Because I thought that was our bigger challenge, not the referral, but the actual assessment of determining the success or not of that child in the program.
Great. So I'd love to hear from folks in chat then, where you might have seen where your process might not have worked, whether it was the assessment piece or actually the, starting with juvenile arrests. Maybe those were really down during the pandemic because law enforcement wasn't focusing there. So let us know in chat where that might have been different, and then where your participant numbers are. And I did these just as really big blocks of kids. And so I was thinking that for a lot of you, you might have less than half of your census that you had before the pandemic. Maybe you only have, maybe your numbers are down just a little bit. So maybe only down by about a quarter. And then maybe your numbers have stayed pretty steady. So if everybody could respond here. And Judge Capizzi, what's your census been like?
We're probably down about a quarter. Because there are some less referrals than before, because the referral base is different. But I don't think it's been a dramatic cut. I think I've stayed pretty steady. I do see it ticking back up again. I would say to you, since the first of the year, there's been more referrals coming in.
Yeah, I think it's one of the things that at the technical assistance level, we had like a lot of conversations last year about whether or not we were going to see lots of programs just basically lose all of their referrals just because the kids weren't necessarily out, although we all found that kids were not terribly good at maintaining the lockdown. Some adults either.
It's critical that the people, in my case, the probation department or the educators, whoever, they need to reach out and get referrals. So the days of waiting for people to call you on behalf of a child, they're past. And so we made a special effort during the pandemic to make sure that we reached out to referral sources to say, hey, we're here. Don't forget that we're here. The crisis may be here, but keep on sending us referrals, because I think it's a never-ending selling of your program. So many of these organizations have quick turnovers. You got to remind them who you are and what you do.
Yeah, I think I think even when we don't have a pandemic, juvenile drug treatment courts exist in a space where they're not always fully integrated in the continuum of services within a community. And so that education of referral sources is so important. Our results are in, and it looks like about half of the audience is down by about half, maybe even a little bit less. And then the other on the other side, the majority of folks have just about the same number of participants. And so I think that's so interesting that we haven't seen that we've seen either a pretty dramatic drop off or things are pretty close to the same. Elisha, I'm going to ask you to chime in now with what you're seeing coming into chat. And I know we talked yesterday a little bit about what we think might happen in the coming up as people start to feel a little more comfortable being out in the world. So Elisha, go ahead and tell us what you're seeing come in.
I'm seeing that some of the numbers are down due to the arrest of youth having been quarantined during the pandemic. It looks like a lot of, yeah, it looks like there's a large number of referrals that are starting to decrease just because kids have been quarantined lately and not out and about. And then there's some that are saying, then there's a specific one, and this one says, my program is not a treatment court. We take referrals from JPO to complete mental health assessments for children. These referrals have been down throughout the pandemic. However, offenses have been more severe where youth are going right to placement, whether that be mental health and substance abuse or secure facilities. So there are, while it looks like the overall blanket is that we're seeing decreases in them, there are some pockets where we're, due to the specifics, we're seeing some increased behaviors or some intensified behaviors.
Jessica, also
Yes.
there's an issue of, do you have a low end or a deep end treatment court? My court, the deep end treatment court. So those kids are normally still being picked up during the pandemic because they're committing more serious crimes. Whereas the courts that are low end, in my opinion, shouldn't even have a treatment court for low end kids. But those that do, those are the kind of ones that have lost a lot of volume because those are the kind of cases the police don't have to pick up and they've chosen not to.
Right. And I think it's interesting that we're seeing maybe some more acute episodes. I know that mental health is a real concern for everyone of the young people because of the lockdowns and maybe the lack of the socialization at school. And so, of course, it's likely that we'd see an increase in mental health challenges and more acute episodes. And then also the idea that substance abuse and use would go hand in hand with that. Now, Elisha, I know you work directly with kids still, and that was kind of your background before you came to NCJ-FCJ. And yesterday, you kind of predicted that you think kids are going to go a little bit wild over the summer. Can you talk a little bit about that?
Yeah, so I won't be surprised if kids have been quarantined for an extreme amount of time and they haven't had any time to be social with their friends or just kind of be out of the house. I do kind of foresee that as they start to be able to branch out, especially because the summer is right around the corner, they've been locked up. I do see, I kind of predict and I'm kind of thinking that we're going to see some increased behaviors, especially for a lot of those kids who have not had access to whatever their safe place was prior to them being in quarantine. And so you can see a lot of the coping skills and all of that behavior management kind of unravel when they don't have access to the resources that they once had. So I'm starting to think that, and even now in some of the chat, we're seeing that, a lot of the referrals come from the schools and the schools have been closed. And as they start, they're starting to see increased levels as schools move from hybrid models into, full classes. And then we have another one that says that there are some issues that they've encountered with their youth maintaining sobriety because of the stress related to the pandemic. And so again, those positive coping skills that we work so hard to kind of put in place sometimes go out the window, especially with this, which has been unprecedented. So,
Wendy, I wondered if you had any thoughts to add to the conversation. And Jackie, I see you were unmuting too, so I'll go Wendy.
Yeah, I think we're going to see some of those increased behaviors because it will be the way that they're going to respond. And plus then now they'll be in spaces where they will be identified as doing things wrong, right? So they'll be in schools, they might be expressing behaviors that are unwanted and get referred or picked up. And same with seeing them out and seeing youth out in the community. So they'll just be out there more. And so eyes will be on them. And I think it's a good thing to think about with the juvenile justice system, because juvenile drug treatment courts are just one piece. And Judge Gupizzi, your court is a really good example of this. It's a continuum of care. And juvenile drug treatment courts need to get really close with all the other programs that are existing in that juvenile justice jurisdiction to think about how are we making sure the right kids are in the right spot at the right time. So we don't have low risk kids in a high risk program like a juvenile drug treatment court, but we also don't have high risk kids in a low risk type of diversion program that we're really thinking about how are we making sure we're meeting all the kids' needs on this continuum of the way our care is, but also the way that they're presenting themselves and the behaviors they have, the risk to reoffend.
I think that's so key to making sure that that we really are matching kids as much as we can, and using those good risk need assessments to do that. Jackie, why don't you have our final thoughts?
Yeah, and I'll just be very quick. There's just research that's just now coming out about the impacts of COVID in terms of the criminal justice system or our mental health system. And there's some recent research that came out in some medical journals that talked about the increase in mental health needs among so many people throughout COVID, and how that's going to impact our mental health systems. And so I think our teams just need to be prepared to respond to both, not only the substance use disorder needs, which is what we usually do, but the mental health needs, and really supporting our clients and our families and our parents around their mental health needs, or even other services, whether that be as the housing moratoriums start to be lifted. I know, many states have had housing moratoriums, and you couldn't be evicted, and some of those are going to be now wrapping up. And so our families are going to be in different states of need, and our teams need to be primed to respond to that. So the other thing I think we're going to start to see, and we're seeing some of this in the official data, which is that, domestic violence has been on the rise during COVID and continues, as well as violent crime. Now, I know we don't serve that population in juvenile drug treatment court, but if they're in a family environment where there's violence, we need to be able to quickly respond to that as well as a team. So being prepared for all of that. And then again, like Judge Capizzi said, marketing your services, what you can do to support these individuals in the community as we move back into the courtroom, move back into schools, is going to be important.
I'll let you go ahead, Elijah.
Sorry, just to piggyback off of what you said, with having those services being marketed, with so many more youth needing them, there's probably going to be a backlog or of those services being able to get to all of them, which is going to pose its own sort of issues as people start to seek them out.
Yeah, and I think the justice system being kind of the biggest consumer of mental health treatment and substance use treatment means that kids who come into the system maybe have a little bit of a faster track for accessing services. But I think that it's going to be possibly a real challenge coming forward. Jackie, I wondered if you had any advice for teams about how to get ready for this. I don't disagree that they need to. Is it just that they need to have some preparedness meetings, or what should they be doing?
Yeah, Amanda put in chat as well that services have been backlogged, meaning that kids are spending more time without the supports that they need. So this is a matter of, convening some meetings with your various providers. If you have a county structure where the funding flows through, or state structure, trying to engage those funding streams, and that process in terms of the providers as well, to try to see how can you strengthen those connections, how can you open up those spots. But there's also a shortage of providers in our communities. So if you've had that availability of telehealth and you can continue to operate with telehealth, that might be an option, or expand telehealth. But even as we expand telehealth, we still have a shortage of actual providers. So
people on the other end of the tele.
Right. So I just, it's important, and Judge Capizzi might have some ideas here too, but I think it's important that we continue to engage all of those stakeholders and probably organize some meetings now rather than, June, July, or August.
Absolutely correct. In my court, we always stay in open communication with all the providers and try and encourage them to do more. I have a concern. This is a double-edged sword, and we don't want youth involved in the justice system. I get that. But you need to check for everybody watching, you need to talk to your police chiefs. You need to talk to what their new theory is on picking up kids post-pandemic. Because I know Elijah talked about more kids being arrested, but I don't know. On those low-end cases, I've seen the police department hands off a lot more. And if they do not arrest kids, we still need referrals for those children that need our help. And so it may not be within the system itself, but giving those youth help in the community without a juvenile record. That's the best of both worlds. But I am concerned about those kids who the police have decided, you know what, pandemic, no one committed that many more crimes, so we just won't pick them up anymore. And that's great for the juvenile justice system for criminal records, but not great for our kids and families. So we need to balance that off with the referrals in our community, show them there are ways to have treatment that don't necessitate having a charge filed against you.
Well, and that's interesting to think, not only have we gone through the pandemic, but we actually are really living in this moment of radical reimaginings of justice and of policing. And we're just right at the very beginning of that. But I think that those things could have really long-term impacts on what happens within our treatment courts and in the justice system altogether. I see that there are a couple of things flashing into chat. And I just wondered, is there anything else that we want to touch on here before I move on to my next question?
Jess, I'll go ahead and touch on that because it is the tip that I wanted to raise my hand and offer. Renee Jones offered the Fulton County Juvenile Drug Court. They put on a provider resource Zoom meeting where all the providers presented what services they're providing and to what population. And that goes directly to the tip that I wanted to give. Like right now, think about resource mapping for those pro-socials because those are so important too. Even if we're providing treatment or substance use treatment, mental health treatment, we want to make sure that we are getting kids into those pro-social activities, especially thinking about how they're coming from this isolated environment. They haven't been able to socialize with their peers or participate in activities. And so do some front end planning about what do we have available now that we are able to gather, maybe be in person in some places. What do we have available for kids in relation to those pro-social activities?
I love that. And I love the suggestion of the virtual Zoom fair. In some ways, again, we think about things that might be a little bit easier to do on Zoom, and it is things like maybe bringing all providers together because there's a little bit less of a time commitment. You don't have to drive somewhere. You can, if you're still working at home, you can do it in your jammies if you want to. And then thinking about things that will continue forward, I think we'll see a lot more. Maybe hearings, only about half of them will go virtual, but I think we'll do a lot more of our partner meetings virtually with only getting together occasionally, which is kind of a bummer because it's so fun to see people, but also going to be really a great time saver. All right, our next question. So we talked a little bit about some things when we were talking about what had surprised you the most. So we did talk about some of the benefits of developing a hybrid or remote court hearing procedures. And so since we've already sort of touched on that, I really want then to hear from the audience about, you can answer this question, but you can also talk about what benefits have you seen from doing some of the actual supervision remotely? And so I know at the very beginning of the pandemic, when we talked a year ago, lots of folks were talking about the like home-based sanctions and providing like workbooks and stuff in people's mailboxes. And so if you could talk a little bit about both any benefits you've seen from this hybrid court process, but then also any benefits you've seen to doing some supervision remotely. I'm going to
add to that question.
Sure.
Have they found any benefit to do remote drug testing?
Sure, let's do drug testing
at home, or screening. Obviously during the COVID, we had to do it all by dropping off at the front door and seeing that experience. And we were pretty impressed with the honesty of families. Now, not to say that there wasn't abuse here and there, but I was pretty impressed that we were able to maintain full testing 2, 3, 4 times a week by doing it by the family taking responsibility for doing it for their child. Again, some mistakes along the way, but I'm curious if other people around the country, was that a benefit? Because does that mean you can do more of that now, or do you think you need to do all your testing in-house to assure the accuracy of it?
Well, and I always think that more of these things happening in the home makes such a great avenue for that better parental engagement, and also hopefully helping the parents take back over as kind of the primary disciplinarians once court steps out of the picture. Martha, you talk about this a lot. What are you seeing coming into chat in response, and what do you think about things happening more in the home as part of juvenile drug treatment courts?
Well, I haven't seen yet anybody commenting specifically on that, but it seems to me, and this is sometimes I think a disconnect between the program and the families, is that parents are kind of confused about, do they turn their kid over to the team, or are they part of the team, and can they get supported? And sometimes it's great when the judges are really clear in court. We want to help, you're a member of the team, we want to help you with your parenting supervision. How is that going? What do you need? And so forth. But in this new arena, this new normal, I wonder if then the POs are working more with than the parents, and helping them with, talking with them. I need your help with the drug testing, and how has it been going? And so I'm hoping that there has been more communication and a sense of support that the families are feeling, especially at this really difficult time of probation officers being available by phone, if they're able to come stop by the house and have some like social distancing interaction. But it seems to me it's one of the, and again, one of those silver lining weird things that it could be that this was something that with the pandemic has actually helped probation officers be even more creative about connecting with parents and feeling like they're on the same side and working with the youth.
All right, and I see that we've got some things coming into chat. Jackie, do you want to comment here?
Sure, a couple great comments from Yvonne and Lauren, just talking about how it's allowed for greater family participation. Now you don't have the issue with transportation barriers, timing barriers. So actually some strengths, it sounds like, in terms of family engagement. Like Martha was just saying, that's such a critical component. And if you've read the Juvenile Drug Treatment Court guidelines, it's foundational to a healthy program to have parental involvement. So we're removing barriers almost, as long as they have good internet service or can join via phone. We are removing that transportation barrier, or even the time it takes to travel down to the courtroom. So sounds like there's been some strengths here in terms of.
I would add to that we've started a program of incentivizing for parents. So I mean, we all said, well, I hope most courts now understand family treatment courts are very strength-based, but also incentive-based programs. And we, in the last few years, have started incentive-based for parents to, again, help Martha with the buy-in. We got a lot of buy-in. And we're able to give at least once or twice, almost every week, we'll give one $25 gift card to one of the parents for succeeding and helping supporting their child to the program. And it's always a gas gift card. It's never cash. It's always a gift card to get food or gas. Most parents seem to like gas more than anything. But I really have seen a lot more buy-in. And I will tell you, when I first got on the bench a long time ago, I didn't quite understand the benefits of incentivizing for the child, much less parents. But now, as I've gone through this change myself over the last 15 or so years, it really helps the family to incentivize for the parents too, to just make that much more support available for them. And I hope most people can find a way. And we do it all with grant money, not grant money, we get donations. I don't want people to think that we're wealthy. We do not pay for it out of our court dollars, we can't. We ask the community for resources. We have a small 501c3 that we set up. If people can donate, so from that little pile of money, we can give all these kinds of monies to families to incentivize.
I'm talking about marketing your program. There's another avenue of marketing that is really important, your referral sources, but certainly really marketing to the community. And I think, again, when we think about this sort of post-pandemic world, it's going to be really key to making sure that we're pulling together within the community and making sure that the community understands that the Juvenile Drug Treatment Court really serves a vital purpose, and that if they have an opportunity to donate, they can do so. And I know, Judge Capizzi, your court, prior to the pandemic, was always doing things with the community to help them understand what you do, and really help them see the value of what you offer. So I always really like to talk about that.
And someone in the chat just mentioned how schools have partnered to let kids participate virtually from school, and we found that too. Another point that I forgot to raise earlier is that we have partnered with the schools to let the kids and families use the school-based computer capability for our hearings. And so many children got computers to take home from school. We've been able to work with the school systems to allow them to use it for our stuff too. So it's another way to reach out to the community. It's always reaching out to try and get a buy-in and a partnership. And that was a great way for us to reach out with the school systems to get them to say, hey, we need you, school system. Can we please use your access capability? And that they want to feel needed. So it worked out good.
I hadn't even thought about that lots of kids got laptops to take home. And so you had this whole avenue of technology just right there available to you, as long as you can make those connections. I like that. Elisha, what have we seen anything else come into chat?
So we've seen a few things. It looks like there are a few places that are dropping the drug test off at home and allowing the parents to participate in that way so that they can, again, get some participation and kind of help be a part of the team. Amanda said that some schools allow their kids to participate in their hearings from school if their internet is subpar. And when school is back in person, the circuit in Miami has created kiosk stations at their courthouse locations for families with technical impediments to participate on Zoom in any court hearing. So it sounds like there are a few options out there. That one that was really cool.
Lots of innovation happening.
Yeah, there's lots of great ideas coming from this, it sounds like.
Jackie, I'm really curious about the drug testing issue, because I know when we started the pandemic, people were concerned about drug testing. And I know a lot of courts kind of stopped drug testing for a while and tried to figure it out. Has NADCP had any kind of expert opinion about this, or what have we been hearing about sort of at-home drug testing? Do we think that this is something that has good efficacy? I think we have some great anecdotal evidence. What have you heard from your colleagues?
Well, on the adult side, NADCP, if you look at the website, they have some materials, some resources available regarding drug testing. Most of this, of course, is always informed by Paul Carey. If any of you know Paul Carey, he's probably the national expert on toxicology and drug testing within our treatment courts. So you could certainly take a look at that material. In terms of juvenile drug treatment courts, though, we are in the process, NADCP and the National Council of Juvenile and Family Court Judges, putting out a paper basically that reviews the latest research on drug testing and drug testing within the juvenile drug treatment court model. And we'll also be having a session about this at the national conference, and we'll be having a webinar on Tune In Tuesday, we're calling them, regarding drug testing in juvenile drug treatment courts. But I guess I'm a little cautious to say that we have any sort of research yet about a best practice during the pandemic regarding drug testing for adolescents, because we have to be very cautious when drug testing adolescents to balance the need of the court and public safety and treatment around substance use disorders, but also where the youth is at in terms of their mental health. And so we still want to make sure that we're balancing all of those considerations when we're doing this testing. But I know that many programs that we have worked with during the pandemic have really turned over that drug testing to the parent, or had the parent or someone within the family be more heavily involved, or in some cases where some states, as you know, didn't have some of the restrictions that other states did. So probation officers were still going into the home and doing observed testing. So we've
And I
kind of
think-
seen this continuum
Broad
of types
range,
of
yeah.
different types of range of drug testing.
And I know that for a lot of kids, they were still going to drop-in centers to do their testing. And
Absolutely. Because those
so for
remained
sure,
open.
there's possibility. But I really applaud courts for jumping in and trying what does home-based testing look like. I think it was the kind of thing that really felt like that was never going to make sense because of the observed and maybe some distrust with families. And so again, I think that this points to the idea that we have more opportunities to partner with parents than maybe we thought we did. And having this opportunity to experiment when we didn't really have any other choices maybe has opened up some windows. I'll be really interested to see if we get any kind of data going down the road about what that looked like for folks in a more scientific way. All right, so our last question.
Actually, Jessica, just real quick,
Yes.
Jessica, we will have some of that coming out of the Juvenile Drug Treatment Court Guidelines study because they're isolating those sites that were part of the research project during that time of COVID to look at practices during COVID, like drug testing. So we'll have some of that coming up.
Excellent. Yeah,
Late-
that's right.
late
I
fall.
totally forgot that we would have some COVID information coming with that. I always think about that project as being really guidelines focused, but of course it occurred during a whole year of the pandemic. So interesting.
Exactly.
All right, so now I just really want everybody to kind of share in chat what your hopes are for your programs as we get back to normal. What kinds of things you really want to pull forward, what ideas you've had about what your program can look like as we get back to something closer to normal. So what are your hopes going forward? And what things do you want to carry forward with you that you've done here during the pandemic that you think would be good during business as usual? And so Judge Capizzi, you think you're going to really keep doing about half of your hearings remotely.
I do,
How are
but-
you going to make those determinations?
Well, each child and family have to be treated differently, but I want to make it clear, it's not that 50% of kids will come virtual all the time. 50% of kids come to courtroom every time. It's that balance, because it is critical. The new norm to me is a balance where you make sure the personalization is important. I think it's critical that the child and the family interact with a judge or a magistrate who's ever hearing the case. I think that personal contact is critical. So I don't want people to think I don't want to ever have kids come to court anymore. I love the kids come to court. You need to balance that off the benefits. And so the new norm to me is being able to have the youth come in enough so that we can interact and maintain a very strong personal relationship. Those are all my kids. And I don't want to see my own kids by phone all the time or by a Zoom. I want to see them in person. And same with these young people. And so making sure the new norm is let's be safe, let's come back to court a lot, but not every single time. And let's make these children and families understand that there is some critical mass is the wrong word. There's some relevance to coming into the building and having that interconnection with the court and the treatment providers. Our treatment team meetings have 4 or 5 providers there. There's a doctor there. There's all kinds of people. I think that interaction is critical. So that to me is the new norm, a combination, but never saying to a child, you're in my program, I'll see you in 9 months when you graduate. That's not what I'm talking about.
Right. And I mean, it one of the kind of secret sauces of treatment courts, not just juvenile, but across the board, is those relationships that are built with the judge, other professionals, and the relationships and the kind of courtroom theater that happens when people are together. And so I do think that there should be a balance between what that looks like and then making things really easy for folks. So have you tasked your staff with changing your policies and procedures to sort of think about what that floor looks like for the number of in-person appearances versus virtual appearances? Or are you guys not quite there yet?
We're there. We're
there.
definitely planning for the future. We're not sitting on what we're doing today. So tomorrow I have my treatment court. Tomorrow I'll have 27 youth in front of me because I have a full day docket of treatment court, some in person, some by Zoom. we're already approaching. Every time we get together, we're thinking about what's best for the next appearance, how often. You have to do that. You got to keep moving as the children and families change and their needs are different.
I always like to have you participate, Judge Capizzi, because you always say the thing that I would say, but you say it from the judge point of view, and that always makes it sound so much more authoritative. So I love that. Wendy, what are you seeing coming into chat, and what are your thoughts about how folks should be approaching this new normal?
Yeah, a lot of being able to balance what Judge Capizzi was just talking about, like how can we keep some virtual and in person, because there's lots of benefits to both. Building that relationship in person, but also reducing barriers to engagement with that virtual. So lots of stuff like that. And I think what for me, like my biggest tip right now for as we're rounding the longest year and more of us are getting vaccinated and we're going to be going into our new normal, sit down with your team and say, what things did we adapt that we want to keep? Make a list and then think about how will you write a policy around that and begin to think about seeing if it's doing what you want it to do, right? So if you are having a balanced approach between in-person and hybrid, how are you using access to virtual, right? Is it being accessed fairly? So is it available to all use? Are you using it the way that it was intended to be a benefit to the families, so to take care of transportation issues, or catch yourself using it as a sanction or an incentive, right? So you really want to keep it steeped into that, what Judge Capizzi was talking about, that real good balance. And you're talking about to the families, getting them to understand it's important for you to come in person, but I understand that you can't do it all the time. And in this individual way, we have also this other way we can meet, right?
I really like this idea too, that teams should be measuring, right? You should be really keeping track of how if you do approach this as a hybrid for in-person hearings versus virtual hearings, even if you're going to maybe keep some of your drug testing happening in the home, maybe that's one drug test out of every 5. The important thing really is to collect that data. And so you can look at it and say, are we being fair? Are there some kids who, for whatever reason, have appeared virtually more often than other kids? Because we know that those are things the kids themselves will notice. And so making sure that we're thinking about how we're always looking at that data and that information to ensure that fairness and equity within a program. Martha, what are your thoughts here?
Well, just again, to kind of piggyback on what others have said, but even when you're thinking about policies and procedures and how you might change them and build in some of the things that you did in this interim time going forward, is also how you're approaching case planning and thinking about how the different options fit. Again, the theme of individualizing, how the different options for kids coming into court in person, or parents, or attending virtually, what have you, is how might that be woven into your case plan? And as others were saying, also, how might it be woven into your responses when it comes to incentives and sanctions? And if a youth is having a tough time, maybe that means that an in-person time with the court makes sense, or would that be an additional burden and stress? And then how could that be worked around? So just, I think that the teams are realizing you have a lot of versatility and flexibility and ability to pivot as you're presented with different things. And so just to keep that going and being kind of liberating, feel like, yes, we want to have policies and procedures, but we can build in some of this flexibility into our policies and procedures.
We know our kids about this. Some kids need to come in person because they want to, and therefore they should. And so that's why it's not the cookie cutter approach. It's we know our kids well enough that certain kids just need to see you, and that's okay to come every week, but not everybody needs that option. So I agree with you completely, Martha.
And I think that's so right about being individualized. The same thing with treatment. I know that some kids really like telehealth and some kids are very uncomfortable with telehealth. And so really thinking about how we're being really responsive to an individual's needs. Elisha, what have you seen come into chat that has struck your fancy?
So I'm seeing things about just kind of finding innovative ways to overcome barriers. That's a big thing for me. My approach is always to kind of figure out how whatever organization or entity I work for can adapt to best serve the population that we're looking to. Increasing access, developing a new normal for what things look like, being more adaptive and being able to pivot more quickly now that we've understood that certain things will happen and we will have to move quickly. It looks like the response to the pandemic is that all of these changes that we thought about prior, that we said we couldn't put into place, we were forced to put into place. And so now we know that we can do many of those things, and just figuring out a way to do it. So, and then
I love that idea that that you have a different sense of your team and your own abilities as professionals because of this. So I like the way of thinking about that.
We just lost Jackie, looks like.
Did, and I was saving her. I was going to give her the final word.
So you're the final word, Jessica. You summarize and talk about the next one.
Yeah, so I really appreciate everybody being here today. Again, one of the things that was a big takeaway for me was how really willing everybody was to be so flexible and try new things. And I think that that the pandemic really did give us this chance to innovate, where we didn't have to necessarily be as concerned about whether or not this was normal or what other people were doing, because everybody was kind of forced to do it. So you all did such a really amazing job of adapting your program, so many different interesting things that you've tried out. And again, we're going to compile all of the chat from today, and that'll be available with the transcript and the video that we'll send out to everybody to take a look at. Really appreciate that. Hopefully you'll be able to join us for the second one. Again, we're going to talk next time all about, and I think this one we'll be talking more about challenges that you've encountered, because we're going to be talking about things like how kids have done with virtual school and virtual treatment, and where you might have some community connections that you had before the pandemic, but maybe you're going to have to be rebuilt post-pandemic. And so we really want to get into that side of the conversation as well. And so I want to thank everybody for their participation today, and we'll see you next time.